Hi, welcome to It Takes Guts. I'm your host, Stacy. I have been a GI nurse practitioner for the past 6 years. Prior to that, I was a nurse in the endoscopy department for 15 years. I love GI. Today, we are talking about irritable bowel syndrome. This is a big topic, and we're going to divide it into 3 different parts because there are 3 specific types of irritable bowel, or the most common. There is irritable bowel diarrhea predominant, irritable bowel constipation predominant, and then irritable bowel mixed. Today, we're going to start off with irritable bowel diarrhea predominant because I think that's the one that most people know about. So what is irritable bowel? For the longest time, we thought it was just only specifically people who were super sensitive in their abdomen or their like visceral sensitivity, or they had a GI motility disorder where they were just having constant diarrhea. But things are starting to change now with that. We're starting to look at, could it be something with inflammation in the GI tract? Could it be something where there's an alteration in our healthy gut flora? Or could it be food sensitivity also? I think that there's a lot of combination going on. It's not just one specific thing. And I think the more studies that are done, the more we're going to see with this coming out and some better treatment options. So specifically, irritable bowel is something where you have abdominal pain. That's usually the main focus. So not all abdominal pain is irritable bowel. Specifically, there is certain criteria. The Rome-4 criteria is what GI providers use to help us really kind of hone in on, is it irritable bowel? So if you have abdominal pain that is associated with some type of change in bowel habits, at least one day a week for the last 3 months, that's kind of our starting point for irritable bowel. So what do I mean, a change in bowel habits? Either you have a change in the consistency. Normally it's a nice log and suddenly it's really watery, or it's little hard rabbit pellets coming out. That's kind of a change in the way it's looking. Or your frequency, it used to be once a day and now it's 5 days in between a bowel movement, or you're going 5 or 10 times a day. So those are the things we're looking at. Now, with irritable bowel diarrhea predominant, we don't want to just presume, well, there you go, you got it. You had some abdominal pain and some diarrhea a couple days a week. That's it. No, you want to definitely rule out any worrisome or warning signs also. So oftentimes you want to rule out some other things like celiac disease. That's a gluten allergy. You would want to rule out some inflammatory diseases in the GI tract, such as Crohn's disease or ulcerative colitis. And that can be done with a stool study, a blood test. Celiac disease can be checked with a blood test. Doing a stool study to make sure you don't have a chronic infection like Giardia or Clostridium difficile or a parasite. That can also be done with a stool study. If you are coming in saying, I see blood in my stool or I see a lot of mucus, that's something that we would want to actually check out with a colonoscopy to make sure we're not missing something there. And if suddenly your symptoms are starting and you're over the age of 45, we would definitely look at a colonoscopy. I actually have a very low threshold for scheduling colonoscopies, even at a younger age. If you're 20 and coming in to see me and you said, I've had symptoms like this my entire life, I'm not necessarily going to rush for the colonoscopy. I'd do some other things first. But again, if there's some concerning symptoms such as blood in the stool, unintentional weight loss, family history of colon cancer, any of these other things, we would definitely do a more detailed diagnostic workup. So let's say we do all this and we're not finding any organic or pathologic cause, and we're like, yeah, this is irritable bowel. That's really what we call a functional GI disorder. So again, it's pain, change in bowel habits, but you're not having a blockage or something. So how do we treat this? First step is diet modification, which is sometimes a frustrating thing because people want to feel better immediately. And we know that dietary changes is not always an instantaneous fix. But one of the things that has been shown over and over and over to have a long-lasting effect is altering your diet. One of the first things is look at your dairy intake. We have a lot of people who will have a lactose intolerance. Cut out your dairy for a little bit and see what that does. One of the things that I talk with my patients about is a low FODMAP diet. You can look it up. That's spelled FODMAP. There are specific food types that, when broken down in our gut, can lead to a lot of gas, abdominal pain, distension, and change in bowel habits. And I very seldom am ever going to say, hey, go strict low FODMAP. That's a really restrictive diet. You would be miserable. And very seldom do you need to do that. but you can look at the chart that it comes with and check out some of the foods on the high FODMAP side. And if you're like, oh, every time I eat that, I get abdominal pain and diarrhea. Well, you should cut that food out for a little bit and see how you feel. There's always alternative foods that you can try to replace with. So you still get your nutrients and everything that you need. So you're not suddenly losing weight and feeling miserable because you don't get to eat. One of the staples, and if you've listened to my other videos, you will not be shocked to hear this, but fiber is hugely important in treating irritable bowel. Oftentimes, psyllium husk, that's Metamucil, or Benefiber, which is a wheat dextrin, can bring some significant relief in helping really bring water into your colon, kind of firm up the stool, give it a little more substance, and you don't get as much abdominal pain or change in bowel habits is something that's really important. So if you've done that and you don't really have any food allergies and you're still having issues, then we can always look at some medications. And that's where your GI provider really comes into play when, you've already talked with them and you've started with the basics and now you're needing some medications. There are some out there, some anticholinergics such as dicyclamine, which is Bentyl, or hyoscyamin, which is Levsin. These are medications that you can take that help reduce or relax the colon. It stops so much of the motility, so it will decrease the diarrhea, but it should stop some of the abdominal pain. Some people don't need it every day. Some people just need it occasionally. Other people need to be on something on a regular basis to help. Sometimes we need to just give you a little Imodium and that can do the trick. Other people, Imodium causes constipation and abdominal pain and you feel worse. Sometimes a bile sequestering agent that kind of binds to that bile salt that your gallbladder releases when you're moving your bowels. If we give you something to just slow it down a little bit, that can help. Sometimes we need to put somebody on a low dose tricyclic antidepressant. And I want to just reiterate, for the longest time, even when I first started in practice, people would come in and say, I've always been told it's in my head. It's just irritable bowel. Irritable bowel is not in your head. It really is going on in your gut. And so when I say a tricyclic antidepressant, it doesn't mean that I think you're depressed. This actually, on a low dose, it helps alter the pain and the discomfort that you're feeling in your abdomen. This is something that we find hugely beneficial for some people. And we give you a low dose and you take it at bedtime so you're not sleepy during the day. But we have found that it helps really slow down the diarrhea, help with the abdominal pain, the bloating. It can even sometimes help with some of the upper functional GI symptoms like a lot of hiccups or burping. So it is a very beneficial medication. Now, is there a component where anxiety or depression can make irritable bowel symptoms worse? Yes, absolutely, 100%. There's definitely a brain-gut connection. And when you're having stressors in your life, you're having a hard time with some other stuff, most of us will have it kind of affect our GI tract. I absolutely will get more nausea, abdominal pain, and more trips to the bathroom when I am under a lot of stress or crazy anxious about something. So that is very common, but that's not just irritable bowel, but it can certainly worsen the symptoms. So those are things to just think about. So this is just one part of irritable bowel that we talked about today was irritable bowel, diarrhea predominant. Big takeaways. If you're having symptoms and you need to see somebody or you're just not sure what it is, please, please, please reach out to your GI provider. We're here to help you. We want to help you get answers and treatment and help you feel good. If you are concerned or you have any unusual symptoms, if you're having weight loss or you're having blood in your stool, mucus in the stool, or you have family history of some GI disease, don't wait to be seen. Please make a phone call, get in to see a GI provider. Please like and subscribe to the channel. Let me know if there's some other things you'd like to hear about. We're definitely going to be talking about some of the other forms of irritable bowel in the upcoming videos. And remember, I want you to be educated, informed, and know that you're not alone.